Hi Healthy Buddies, welcome to my channel where we will discuss about various health matters. I'm Tirtawati Wijaya, a medical doctor, and today we will discuss about cancer treatments. If you or someone you love has cancer, I want you to know this. There are many treatment options and the choice matters. In this video, I will explain about the current available cancer treatments so you as a patient, caregiver or curious viewer can understand the options. Cancer is one of the most studied health conditions, and scientists around the world are racing to find a cure for it. There are many different types and subtypes of cancers, and nowadays we have many different treatment options to treat those different types of cancers too. Generally, the treatment fall into two groups, local and systemic. What local means? Local therapies treat the tumor in a specific place. This works best when the cancer is confined to one area. But sometimes, local therapies can be used to relieve symptoms or improve the quality of life of patients with metastatic cancers, whose cancers already spread to other parts of the body. This is what we call palliative care. Classic examples of local therapies are surgery and radiation. Other local physical treatments you might hear about are photodynamic therapy or light activated drugs, hyperthermia using heat, lasers, and electrotherapy. These are useful in select situations but are less broadly applicable than surgery or standard radiotherapy. Let's dive slightly deeper. Cancer surgery is the process to remove part or all of a tumor from the body. Surgery was the oldest cancer treatment developed and is used to treat many types of cancer. There are many different types of cancer surgeries too. Some need a large incision. Some can be done via a small incision using a special tool. We call it keyhole surgery because of the size of the incision. Some surgery don't have an incision at all. Most cancer surgery is done by surgeons specializing in cancer called surgical oncologists. But some types of cancer surgeries can be done by other specialists too, depending on the type of cancer and the surgery. There are many reasons to do cancer surgery. Number one, palliative care, as I mentioned earlier. Other than palliative purposes to relieve the symptoms or improve patients' quality of life, cancer surgeries may be done to diagnose cancer. This is called biopsy. In this surgery, doctor will remove a tissue sample. It may be small part of a tumor or all of it, then send it to a specialist called pathologist to look at the tissue sample under a microscope to find what's wrong with it. Patho means disease. So biopsy can be done for other diseases too, not only cancer. The pathologist then reports to the primary doctor whether the tissue sample contains cancer cells and if it does, what type. Number three, to stage the cancer. The most commonly used cancer staging is DNM method. That is staging the cancer based on the size and the extent of the primary tumor, the number of nearby lymph nodes that have cancer, and whether the cancer has metastasized. It means spread from the primary tumor to the other parts of the body. Nowadays, cancer staging is done with imaging tests like PET scans, CT scans, MRIs. But in older times, when these imaging technologies were not available yet, or in certain areas of the world where the patient has no access to those technologies, doctor may remove the tumor to know how big it is and may also take some lymph nodes near the tumor to find out whether the cancer has spread there. The cancer staging and other test results are helpful to decide on the suitable treatments for each patient. Cancer surgery can be done to treat the cancer only if the cancer is only in one part of the body. If all part of the cancer can be removed along with some healthy tissues surrounding it, this may cure the cancer. Some patients may only need the surgery. Others may need other treatments before the surgery to shrink the tumor or after the surgery to destroy the microscopic cancer cells that might escape the surgery. Sometimes the cancer cannot be removed completely, maybe due to the position, location, or its effect to other structures around it. In this case, usually the surgeon will try to remove as much cancer as possible to decrease the amount of cancer to be treated with other options. This helps to increase the other treatment's effectiveness. Surgery is commonly done to reconstruct the body too, to preserve the body function or appearance as much as possible. This is important for cancer patients' quality of life post-cancer treatment. Surgery can also be done to lower the risk of getting certain cancers. Maybe you've heard about Angelina Jolie's prophylactic double mastectomy and salpingo-ovarectomy. She decided to remove healthy, non-cancerous breasts, fallopian tubes, and ovaries because he inherited BRCA1 or BRCA1 gene mutation from her mother. By removing those organs before cancer is found, she significantly decreases her risk of breast and ovarian cancers in the future. Despite being called preventive surgery, this surgery does not guarantee cancer prevention. It helps to lower the risk significantly, but people underwent such surgery will still need to do routine cancer screening tests for early detection. Radiation therapy is cancer treatment that uses high-energy particles or waves like X-ray, gamma rays, electron beams, or protons to kill cancer cells. There are different ways to deliver the radiation therapy too, depending on the type and location of the cancer. We will discuss about this in a short while. The doctor specializing in radiation therapy is called radiation oncologist. But radiation therapy usually done by a multidisciplinary team consisting of the radiation oncologist who develops, prescribes, monitors, and manages the treatment. Radiation therapist who delivers the treatment on daily basis. Medical physicist who ensures machine and plan accuracy. Then medical dosimetrist who crafts the therapy plan. And the nurses. There are three major ways to administer radiation therapy. Number one is the external beam radiation. This is the most commonly used method where radiation machine will deliver high energy rays through patient's body into the tumor. Generally, there are three types of radiation beams available. And one is photon beams. This is like X-ray, the one being used to see broken bones or dental cavities, but much stronger. The beam will go through patient body, hit the cancer cell, then exit at the other side of the body, damaging the healthy cells along the way. Examples of proton beam radiation therapy methods are three-dimensional conformal radiation therapy or 3D CRT, intensity modulated radiation therapy or IMRT, stereotactic radiosurgery or SRS, and stereotactic body radiation therapy or SBRT. They go with several different brands like X-knife, CyberKnife, Gamma knives. Then we have image-guided radiation therapy or IGRT to adjust patient's position in order to aim the radiation beam exactly on the tumor and limiting exposure to the surrounding healthy cells. Then we have particle beams. This is using protons or neurons that release their energy at certain distance. These beams can reach the tumor deep inside the patient body and stop at it, doesn't go beyond it. This technology allows more radiation to the tumor and less damage to the surrounding healthy tissue behind the tumor. We also have electron beams. As the name implies, this is using electrons that do not travel very far. Therefore, they are only used to treat superficial cancers like skin cancers. External radiation can be given several minutes, once or twice a day, for several weeks as an outpatient treatment. The small doses are given over those many days because giving a single large dose may be too much for the body to bear. Sometimes it can be done during the cancer surgery too. That is called intraoperative radiation therapy or IORT, usually for tumors that cannot be removed completely, where the surgeon removes the tumor, then the radiation is administered directly to the tumor area to reduce the risk of recurrence. Number two, internal radiation or brachytherapy. This is done by inserting the radiation source inside the tumor or next to it inside the patient body. This therapy usually needs 1 or 2 days of hospitalization. Number three, systemic radiation. In this method, the radiation source is administered via patient's mouth, being swallowed, or veins, being injected. The radioactive drugs then travel throughout patient body. That is why it is called systemic radiation. But despite being called systemic, all radiation therapies, including the systemic radiations, are considered local treatments because they don't reach all parts of the body. Even though the systemic radiation drugs travel throughout the patient's body, the substance will only gather in the tumor and not really affecting the other parts of the body. That is why radiation is not really effective to treat metastatic cancers that already spread to other parts. And that is why cancer staging is as important as biopsy in considering treatment plans. Radiation therapy is considered local therapy because the radiation team will plan and deliver the radiation carefully to destroy the cancer while minimizing the harmful effects to the healthy cells around the cancer as much as possible. I've heard some patients ask,
is it true that radiation therapy causes cancer?
well, to some extent it is true. Radiation therapy and some chemotherapies can be carcinogenic. That is why therapy planning and dosing are taken very seriously, administered very meticulously, and monitored very closely to minimize these unwanted effects as much as possible. Cancer survivors who had these treatments have a slightly higher chance of developing another cancer compared to the general population. These secondary cancers may appear many years, even decades after the treatment is over, while patients may not be able to survive that long without the therapy. Therefore, these treatments can still be considered because the benefit of the therapy is much greater than the risk. Furthermore, not everyone who receives radiation therapy will develop secondary cancers. There are several factors affecting the risk, like the age of the patient when the radiation was given, the doses of the radiation, how wide the area of the body being treated, type of cancers, therapy combinations, general health, and etc. The oncologist will consider all these factors in prescribing the therapy. So, if radiation therapy cannot treat the whole body, and unlike surgery as local treatment, can raise the risk of secondary cancer cells in the future, albeit small, why do doctors recommend radiotherapy sometimes? Well, because each treatment modality has their own characteristic, their own plus and minus points. Radiation therapy commonly being utilized to cure early stage cancer. For cancers that are sensitive to radiation, radiation can completely destroy the cancer cells and cure the patients without surgery, chemo, or other more invasive options. For other cancers, it may be combined with chemo or other treatment modalities. Number two, to shrink tumors before the cancer surgery to improve the success rate of the surgery. We call this neoadjuvant therapy. Number three, to lower the risk of cancer recurrence. If the radiation is administered after the cancer surgery to help to clear the tumor area, it is called adjuvant therapy. Sometimes, radiation administered on the area that cancer most likely to spread, even though that area do not have any cancer yet, to prevent the spread before it happens. Number four, to relieve symptoms suffered by patients with advanced disease. In this scenario, radiation therapy can be used to help patients with metastatic cancers too. I know I've said earlier that radiation therapy is not really effective to treat cancers that already spread to other parts of the body. But palliative care has a different focus. It is to improve or at least to maintain patients' quality of life, not necessarily to cure the cancer. Now let's learn what systemic means. Systemic therapies travel all over the body and can treat cancer cells anywhere in the body. Because they are affecting the whole body, they are more suitable for metastatic cancers that has spread or when microscopic cancer cells might remain after local treatment. Doctors who specialize in treating cancer patients with medicines are called medical oncologists. The oldest type of cancer medicine is chemotherapy, but scientists all over the world keep on working on new drugs to treat cancers. And now we have more systemic treatment options besides chemotherapy, like targeted therapy, immunotherapy, hormone therapy, and bone marrow transplant procedures. Chemotherapy is the cancer treatment that uses drugs to kill dividing cells, stop or slow down the cell's growth. There are many different chemotherapy drugs. Some can be used alone, some to be used in combination with other chemotherapy drugs, but mostly it is combined with other types of cancer treatments. Chemotherapy is notorious for its side effects because it is affecting all fast-growing cells, not only cancer cells, but the healthy, quickly dividing cells too, like the cells lining our gastrointestinal tract, bone marrow, or the ones at the hair roots. The good news is most of these side effects will go away after the patient completes the chemotherapy. Targeted therapy is cancer treatment that uses drugs aimed at the specific features, changes, mutations, or proteins in cancer cells, the one that enable cancer's tumor to grow, divide, and spread. This is the main difference from chemotherapy that affects all fast-growing, rapidly dividing cells, including healthy cells. Targeted therapy only acts on unique aspects of cancer cells and leaves the healthy cells pretty undisturbed. But as great as it sounds, targeted therapy is not for all cancer patients. Some drugs are readily available, while many are still being studied or developed. The target in the cancer cells can be different from one person to another too, even if they have the same type of cancer. That is why oncologists often need to do biomarker testing to know whether the specific patient may respond to targeted therapy. Targeted therapy is considered precision medicine for this reason. Immunotherapy is cancer treatment that helps patients' own immune system to fight the cancer. One of our immune system's main job is to detect and destroy abnormal cells, but cancer cells have special ways to evade immune system and grow uncontrollably. Some cancer cells may have genetic changes that camouflage them from the immune system. Some have specific protein in their surface that inactivate the immune system, etc. Different immunotherapy works differently. Some immunotherapies are checkpoint inhibitors. Some are T-cell transfer therapy. Some are monoclonal antibodies. Some are modulators. Some are cancer vaccines. The responses can be dramatic, but can also hard to predict. One common misconception about immunotherapy is many people think that
Immunotherapy has no side effects because it is using our own immune system to fight cancers.
the truth is, our own immune system can also damage our own body. The immune system that has been modified and strengthened to fight cancers can also wreak havoc in our body. Hormone therapy is cancer treatments used to treat cancers that are hormone sensitive, like breast, prostate, ovarian, uterine cancers. That being said, not all those cancers I mentioned just now are hormone sensitive. For example, some prostate cancer patients can respond very well to hormone therapy, while other patients, also with prostate cancer, do not respond at all. To know whether a tumor is hormone sensitive, pathologists will examine patients' tissue samples to find certain protein on the cancer cell surface. It is called hormone receptors. Some cancers of the same type can have different hormone profiles. For example, some breast cancers are estrogen sensitive, some are progesterone sensitive, some are estrogen and progesterone sensitive, while others are estrogen and progesterone negative. Information about this hormone profile can affect the treatment planning. That is why, again, biopsy and tissue sample examinations are very important in cancer treatment planning and decision making. Stem cell or bone marrow transplant is used to restore blood-forming cells after high-dose chemo or radiation. Every therapy has trade-offs. There is no one single solution that works for all cancer patients, and latest novel drugs or technologies are not necessarily the best for everyone. Patients and doctors need to work together to plan the treatment to match each patient's unique condition and response to the treatment. Decisions depend on the tumor type, stage, biomarkers, patient general health goals, whether it is curative or to control the condition or palliative, and access of therapies or clinical trials. Always discuss the goal of treatments with your team. Supportive care like anti-nausea, growth factors, pain control, nutrition, and palliative care are part of modern cancer care to maintain quality of life. When your doctor suggests palliative care, it doesn't mean that your days on earth are coming to an end. It simply means that the objective of the care is to improve or at least to maintain your quality of life. It is true that palliative care are commonly given to terminally ill patients, but it can also be deployed by a team who is still actively fighting to cure the disease. As much as possible, patients don't have to suffer in their fight against cancer. That is my sharing today about cancer treatment options. I hope this information is beneficial for you. If you like this kind of health education content, please like this video, subscribe to this channel, and activate the notification to get more content like this. If you want a deep dive on any therapy I briefly mentioned in this video, like how checkpoint inhibitors work, or if you have any health-related questions or topics you'd like me to cover in future video, feel free to type them in the comment section below. I read everyone. However, just a friendly reminder, I can't provide personal medical consultation here. It is always best to discuss your individual condition directly with your doctor. Thank you for watching and supporting this channel. See you in the next video. Stay healthy and happy.